Okay, so let's just picture this for a second. You're a US healthcare provider, right? But your office, well, it's a cafe in Paris, or maybe a beachfront apartment in Costa Rica. You're running your entire US practice from nothing more than a laptop. Now, with virtual care blowing up, this dream feels closer than ever. But it also brings up one massive question. And this is it. This is the big one, isn't it? Can you actually, legally, and ethically, provide care to your patients back in the States while you are physically located in another country? So let's get right to it. The answer is yes, you absolutely can. And that's the good news. The not so good news? It's definitely not plug and play. See, doing this the right way takes some really careful legal planning, which is exactly what we are going to break down right now. To really understand how all this works, you have to get your head around one single golden rule. Seriously, this is the concept that everything else is built on. And it all comes down to where you are versus where your patient is. This right here, this simplifies everything. Your physical location, I don't care if you're in Rome or Tokyo, it doesn't actually determine the legality of the care you provide. What matters, the only thing that matters for licensing, is your patient's physical location when you're treating them. You have to be licensed in the state where your patient is. Period. End of story. And just to be super clear, we're not just talking about physicians here. This rule applies across the board. So whether you're a nurse practitioner, a PA, a mental health provider, or even running a virtual med spa, the law is the exact same. You follow the licensing rules of your patient's state. Okay, so you got the golden rule down. Now, let's look at how we build this out into a real, practical, and, compliant practice. The best way to think about it is like a checklist for building your legal foundation from the ground up. So here are the 6 big pillars you've got to have in place. You need a formal U.S. business entity, rock-solid data security for HIPAA. You got to be aware of international data laws, have U.S.-based banking, a crystal-clear understanding of prescribing rules, and, of course, the right malpractice insurance. Let's just touch on a few of the big ones. First things first, this one is completely non-negotiable. Your practice can't just be you with a laptop. It has to be set up as a formal US-based business, like an LLC or PLLC. This is what anchors your entire practice in the US legal and financial system, and it gives you that crucial liability protection and legitimacy. Now let's talk about prescribing. If that's part of your plan, you have to know about the Ryan Haight Act. This is a federal law, and it puts really strict controls on prescribing controlled substances through telehealth. A lot of the time, it still requires an initial in-person visit, which, as you can imagine, is a major hurdle for a purely remote practice. And you've got to follow this on top of any state-specific laws. Okay, this one is huge. You might just assume your malpractice policy has your back, but you need to confirm that, and I mean get it in writing. So many standard policies will not cover you if you're physically outside of the US when you deliver that care. And trust me, the last thing you want is to find out you're not covered after an incident happens. So, beyond all the legal and operational stuff, there's this huge human element here. And it all boils down to one thing: trust. To build that trust and keep it when you're thousands of miles away, well, transparency isn't just a good idea, it's everything. And this isn't just a friendly suggestion, it's a hard requirement. Your patients have an absolute right to know where you are. Trying to hide this fact, that's just a fast way to destroy trust and land yourself in some serious legal trouble. It has to be clear, upfront, and totally unambiguous. It's really the foundation of that ethical provider-patient relationship. So where do you put this disclosure? The short answer: everywhere. It needs to be stated clearly in your consent to treat forms. It should be right there in the disclaimers on your website, and it has to be included in your official privacy policy. You want to make it impossible for a patient to miss it. Okay, so your legal foundation is set. Your patient communication is totally transparent. What's next? How do you actually market this unique practice of yours? How do you promote it without getting into trouble? Well, the marketing rules of the road here are pretty straightforward. First, and this is the big one, do not misrepresent your location. Be upfront about it. Second, the usual rules apply. Don't make any health claims you can't back up. And third, and this is critical, do not market your services to patients in states where you don't hold a license. That is a fast track to serious trouble. So we've covered a lot. We've talked about that golden rule of licensing, the full compliance checklist, and why being transparent is so important. We've really taken this idea from just a dream to something that's a concrete, actionable plan. It's about combining that global lifestyle with a totally compliant, US-based practice. So at the end of the day, the crucial point is this. You don't have to live in the United States to run a legal, thriving healthcare business that serves US patients. It is 100% possible. But, and this is a big but, it's a structure that has to be built, not just stumbled into. You have to have the right legal foundation to make it all work, for you and for your patients. Building that foundation is really the key to unlocking this whole opportunity. You've got the framework now. You know the critical rules of the game. That dream is totally achievable. So the only real question left is, what's your first step going to be?